Are we live? I think so. Okay. Greetings. Welcome to PPI Aachen webinar series. PPI Aachen is a student-led organization made up by Indonesians living in Aachen. My name is Firia Andriana, the host of this webinar and a member of PPI Aachen. Today's guests are Markus Instenberg and Anna Esposito, both of these people above me. Both are college consultants from the social health insurance provider in Germany called Techniker Krankenkasse, or in short, TK. Today's topic is about the German health insurance system, but since a lot of videos has been made about it, we would like to make a twist to this topic by comparing it with the Indonesian health insurance system. More on that on the next slide. At the end of this webinar, we'll promise you that you will know what you can do with your health insurance card in Germany. For those who are in Indonesia, you will know what health insurance is like over here. It is mandatory to have health insurance when someone wants to study and live in Germany. Okay, what is the goal of this presentation? Our main goal is to introduce the German health insurance system to an Indonesian audience using a well-known health insurance provider from both countries. From the German side, we have Techniker Krankenkasse, or TK, and from Indonesia, we have BPJS, the Indonesia National Health Insurance. The data about Germany has been provided by TK, and the data about Indonesia's BPJS is public information from their own websites or the National Statistic Bureau, BPS. Just like what the title has shown, this information is just an introduction to both health insurance systems. We will be seeing the difference and similarities on the surface level. This would be no much discussion on the government policy suggestions. We're not really qualified for that. Okay, here is what we are going to explain today. The first is the historical background. When was these health insurance were founded? And we know the difference between the past and the present. After that, we'll be showing how big of the percentage of the population this health insurance provider covers in Germany and in Indonesia. Later on, we'll talk about service and amenities, what you can do with it. After that, we'll talk about how much do people need to pay to be insured. It's the contribution and payment scheme. On the next topic, we'll be comparing public opinion and public satisfaction. After that, we'll be telling the rules and regulations for people who live in Germany. And finally, we'll be talking about exclusive benefits and strengths from Techniker Krankenkasse. Okay, now I'll be handing it over to the speaker to introduce himself.
Yeah, hello together. Also a warm welcome from my side. Thanks for the introduction video. Yeah, a few words to my person. I'm Markus Instenberg. I'm 29 years old and I'm campus consultant of TK. What it means is I'm a specialist for international students and employees specialized here in Aachen. So I'm the personal advisor to the contact of TK, and I'm specialized for these international customers here, because in Aachen we have a big university with RWTH, and we have a lot of international customers, and my job is to advise them, to help them regarding the insurance, and that's my job. And but I'm not alone here today. I have also a colleague with me, and she also will present herself now to you.
Yeah, hello everybody. My name is Anna Esposito and I'm 27 years old. And just like Markus said, I'm also campus consultant of TK and specialist for international students and employers here in Aachen. Just like Markus already said, we are your personal contact to TK. And to keep it short, I would say let's start with the presentation now.
Okay, let's then start with the presentations, which is the historical background. Okay, in spite of the fact that BPJS Kesehatan was established in 2014, the underlying structure needed to support the majority of the Indonesian populations has been developed since 1968. Actually, the concept of health insurance has existed since the Dutch era, but the story really begins when the health minister made laws that provide state employees and their families with health insurance. In 1989, it became a state-owned company that covers more people, which are veterans and their families, in addition to state employees. 4 years after that, it turned into a limited company, which in 2005 was given a mandate to cover poor citizens who aren't covered by other means like regional health insurance provider. Finally, in the year 2014, it became a national health insurance provider we now call BPJS Kesehatan. It's no longer a company, but an organizational body controlled directly by the President of Indonesia. Its aim is to be universal and mandatory for anyone who lives in Indonesia. Are they successful? We'll see later on. Now to the German healthcare system.
Yeah, thanks Virio for the introduction of the Indonesian healthcare system, and now the comparison to our healthcare system here in Germany. The historical background starts a few days earlier than in Indonesia, and the main person who organized the start of the healthcare system was Otto von Bismarck. And that was round about 1883. And also at the same time, 1 year later, TK also was founded. And TK there also was founded for technicians and architects. So in this time, only some people can insure by the Techniker, which have a technical job, and that's for the TK. We have other insurances in Germany, which also was founded for specific jobs, and that's the thing, and that's the start of the healthcare system here. And currently we have a lot of insurance companies here in Germany, and we have a specialized form of the company here. We called it in German, we called it Selbstverwaltung. That means that all the insurances can manage herself or himself, and that means that we can decide about the contribution, about the benefits, but we have a few laws which we must respect it from the government, because the government gives the rules, and the other companies like DK work with these rules. And today we have a good healthcare system here in Germany, and I guess it's one of the best in the world. And that's one big advantage here in Germany. Correct. Okay, next. And here, you can see the principle of the healthcare system. Let me tell you that the key principle is solidarity for the German healthcare system. how Viru said this in the introduction, every people here in Germany have to have a health insurance. That means if you study here, if you are working here, in every situation you have to have a health insurance. And yeah, that means that we have a big solidarity. So that's the young pay for the old members, the rich pay for the poor, and that's one key that or that's one big thing that makes the healthcare system in Germany very strong. So when you have here, when you have an illness, then the healthcare system will help you very good because of the big solidarity here in Germany. And yeah, that's one of the key facts from our mindset to health insurance here in Germany. Correct. Yeah, then next.
Yeah, and following, I will tell you some facts about the current healthcare insurance coverage here in Germany. Yeah, we have two types of insurances. It's the private one and the social health insurance. And for example, TK is a social health insurance, which means we have the principle of solidarity, which Markus just explained what this means. And yeah, every member of TK has the same benefits regardless of their income and how high the contribution is. So TK operates only cost covering and does not make any profit with the contribution from our members. In contrast, the private health insurance has the goal to make profit. You insure your personal risk-taking individually, and this means the more you pay, the better your coverage will become. And as you can see on the diagram on the left in the presentation, the majority with 87.7% in Germany is insured by a social health insurance, and only 10.5% are insured by a private one. So you see there's a big difference between the percentages, and a very, very little amount with 1.8% is in any other way insured. Okay, let's have a look at the advantages of a social health insurance and the reason why so many people are insured by the social one here in Germany. First of all, we don't have a medical examination. So no matter what illnesses you had in the past, a social health insurance doesn't ask for it. Second one is you are more flexible through additional cover. And if you go to see a doctor, you don't have to pay in advance like at the private health insurances. You only have to show your electronic health insurance card and you will be treated by the doctor. And another advantage is that if you have any chronic diseases, you don't have to pay extra rates for this. At the private ones, it is like this. If you have chronic diseases, they can execute you or you have to pay extra rates. And at the social health insurance, you cannot be excluded. And as I mentioned before, you have the health insurance card, which enables a direct billing with TK or another social health insurance. Yeah, you are also able to switch between many different social health insurances here in Germany. And last but not least, if you have any children, they can be insured with you at no additional cost at family insurance. And of course, all of these advantages apply to TK. Okay, and now let's see what the Indonesian healthcare system is like.
Okay, we have seen the percentage of the German populations that use social health insurance. Now let's see how Indonesia is doing. BPJS Kesehatan is clearly the biggest health insurance provider with around 56%. That's still somewhat smaller than the German social health insurance. More than 2/3 of BPJS Kesehatan users have its cost subsidized by the government in some form or way. The regional health insurance provider is the second biggest health insurance from both work and private insurance, playing the smallest role. But do you know what is not small? Is the percentage of the Indonesian population that is not covered by any insurance, 34%. Rural people are less likely to have health insurance, sadly. More tendencies and more correlations can be found in the Badan Pusat Statistik. An interesting note to add is if you add all of the percentage together, it will not be 100% actually. It would be around 105%. That means that there is an excess of 5% of the populations that has double health coverage. That's at least 13 million people in Indonesia. From this statistic alone, there are more things to be desired, and we would like to be much more closer to what the situation is like in Germany. Okay, service and amenities. Let's start with the German healthcare system.
Yeah, as you can see, you are able to get very much treatments like medical treatment, dental treatment, hospital treatment, sick pay, medicines, medical equipment, and other remedies. Also rehabilitation, important medical checkups, and courses in preventive, and much more. And as you can see, our benefits are nearly endless and it would take forever to list them all. So these are only the basics, and later we will talk about TK's special benefits. Yeah, and now let's have a look at the contribution.
However, before we start with the contribution and payment scheme, we would like to have like a short comparison with the Indonesian healthcare system. Well, it seems that BPJS has less amenities than TK, but most of the essentials are somewhat similar. From BPJS official website, it is advertised that people who are covered by it are able to get medical treatment, preventive care, and so on. To know further, you can contact BPJS administrator or consultant. Since we're focusing more on the German side of things, we'll leave it by that. One interesting thing to note is the step people need to take in order to get healthcare services, since hospital capacity is quite limited in Indonesia. You need to first go to the public health center, Puskesmas. If your problem is not fixed, then you may go to the regional hospital. And finally, if the service is not enough, you are able to go to the private hospital. Seems quite limited. Maybe this next slide might help to find the reason why, which leads to the contributions and payment scheme. Well, let's first start with the Indonesian health insurance system. The health insurance provider BPJS pricing system is based on tier list. The assumption would be the higher the tier list, the more services and amenities you can get. But generally speaking, the system is also inspired by the Singaporean health care system, in which the higher tier users subsidize the lower one. Anyway, the biggest distinction is if you have a constant recurring income or not. I would like to emphasize that a noticeable chunk of the Indonesian populations are working in the informal economy, just like any other developing countries. The first tier are 150,000 rupiah a month, 85 euros. The second tier are 100,000 rupiah a month, less than 6 euros. And the third tier are 42,000 rupiah, which is 2.5 euros. For those who are lucky enough to have a constant recurring income, you need to pay 5% of your income, 4% is paid by the employers, and 1% is paid by you. I wonder what it's like in Germany.
Yeah, in German we have the contribution differentiated to the persons we have here. Maybe interesting for you all who are looking right now. We have here the contribution for students, and there we have a difference between the age. Yeah, for all students which are younger than 23 years, we have the contribution from around about €108 monthly, and for students which are about 23, then we have a contribution from €110. A little important information here is that when you are older than 23 and you have a child, then you also must pay the lower contribution. That depends from the long-term care insurance here in Germany. The other part of the social insurance parts. Yeah, and the students insurance in social insurance goes until the age of 30. After that, you can be insured as a student anymore, so that you have to pay round about €200 monthly. Yeah, and without children, €202 monthly. That's the contribution for students in the German healthcare system specialized by TK. Okay, next.
Okay. To have a bare comparisons of the health expenditure of both countries, we are showing you right now the per capita health expenditure in selected countries in 2018. First place goes to United States for peculiar reasons, and Germany is number 4, quite similar to other European countries, which are Switzerland, Norway, Sweden, and Austria, I mean. More like Indonesia comes second last, just before India. More expenses doesn't mean better healthcare. There are many variables. Maybe the government is able to push the healthcare costs down, or more obviously the currency price of the dollars to their national currencies are vastly undervalued. However, if we look at the health expenditure as a percentage of GDP in selected countries in 2018, the trend stays constant. Currencies are not the only reason, it seems. It seems that Indonesia as a society spend less on healthcare in comparison to other sectors in the economy. Coming back to Germany, most of the European countries are quite similar to one another. Now we are comparing it to Switzerland, France, and Sweden. Okay, public satisfaction. This graph shows the answer from a questionnaire that asked the German social health insurance user how satisfied they are with their health insurance. The results are the majority of them are either very satisfied or somewhat satisfied with their current system. They do have a really good trust in it. For the questions in Indonesia, sadly, I couldn't find a polling for this question, so I just resorted to a social media called Reddit. There are rooms that are filled with Indonesian topics, and I just put the polls there. Just a reminder that this data will be biased to some extent. Nonetheless, it seems that more people are satisfied than people who are not satisfied by BPJS. The elephant in the room is the bar on the right side, which is the percentage of people who could not answer. Maybe they live abroad or they use other health insurance provider. Anyway, I leave the rest of the presentations to you two.
Yeah, there are also some rules and regulations for the students. Like if you start working while studying, there are some differences. For example, if you start a mini job, you can earn up to 450 euros, no matter how many hours you work. And your insurance as a student will still be active. The second is if you are short-time employed, your job is limited to a maximum of 3 months per year. And you will also, like at the mini job, remain as insured as a student. In general, you need to know that it doesn't matter how much you earn if you work not more than 20 hours per week. Otherwise, you will be insured as an employee if you work more than 20 hours per week. Yeah. And I think this is basically it. Let's move on with benefits and strengths of TK. In addition to the basics that every health insurance covers, here are some strengths of TK. Like, for example, if you want to go on a trip, on a private trip, TK pays for the travel vaccinations recommended for the country of your destination. These can be very expensive. For example, if you know the malaria prophylaxis, it's very expensive and TK pays it for you. That's a very big advantage to other health insurances here in Germany. Another strength is that you can be examined by a specialist in sports medicine. So if you are a very sporty person and you want to have a checkup from your heart and from your musculoskeletal system, TK assists you with this. We also pay for the HPV immunization against cervical cancer up to the age of 26. And this is for both, for boys and girls. Yeah, in addition to the normal medicines, TK also pays for alternative medicine up to 100 euros per calendar year. And there are many other strengths, and Markus will continue now with some of them.
What are the other main benefits of TK? Anna already explained some benefits from the doctor, but in our experience by TK, we made it that many international customers have a lot of questions about the healthcare system, and for these questions, we have an exclusive TK welcome service for you. What are the advantages of this TK welcome service? We have English-speaking customers, English-speaking college or colleagues, which will help you. Yeah. So Anna or I, we are also English-speaking and can advise you and can support you. But when you are a member of the TK welcome service, you will get an email address and a phone number from our colleagues in Berlin, and they will assist you as good as they can to have a good start here in Germany. And the service goes also to these benefits. For example, when you need an appointment for the doctor, you can write my colleagues an email and we will arrange the appointment for the doctor by you and give you then a feedback. That's a very good service, and TK is one of the biggest health insurance companies and one of these companies which prefer or offers a very good service, including this welcome service. Yeah, that's a big advantage. Okay, next. Then some other strength of TK. I guess a lot of you knows that we live in the digitalization, and the digitalization of the healthcare system is a big topic in Germany, and TK is a big player in this rule and goes straight away to the digitalization, and we have a lot of informations for you about this. We offer a lot of digital service. We have a great TK app, which I recommend to every customer. Download it and use the services there. You can contact TK about this. You can send us bills, which we can pay the money for you back. We have a bonus plan where you collect some points for when you do some sports, and then you can also get a little cashback. And also we have a TK Doc app. Yeah, maybe here in Germany in the time during Corona, it's not so good to go during the city or in the city, and there you can call about video call a doctor and have their appointment, and that's some more strength of TK or some benefits which we offer you more than other companies. And the big advantage for you then is you can decide, use all the digital services, or I use normal services to call TK or to go in the office. You have the free choice as a customer. That's one big advantage for you. Okay. Yeah, these are some birds of the apps. One other important information, in my experience, I advise a lot of international students like you, and there is a question which comes a lot, is the questions regarding international insurance. So you have the upgrade, or you have the option to upgrade your TK insurance to an international insurance for all over the world. And then you are insured and all over the world for every travel up to 8 weeks, and there are no extra fees for you for TK member, and you can easily apply online to it. Yeah, that's an offer which TK offers. Yeah, why we or about the experience we had with international customers, we offers this topic for you. Yeah, or this offer. Okay. Yeah, and I guess so we are now at the end of the presentation now. And now we are here for a Q&A to answer the questions. Maybe you had a lot of questions during the presentation, then we can answer it you right now. And yeah, let's have a look on your questions.
Okay. I advise everyone's microphone to be turned on to answer this. So since the beginning of the month, the PPI Aachen have made this thing inside a website called vaksin. It's usually been done by professors, but now we use it so that we can collect questions prior to the presentation itself so that we can be prepared better. The questions mostly are in Indonesia, so I will help all of you to translate it into English. Okay, for the first question is, how much does TK cover for dental health control? Seems that there are some misunderstanding there. So
yeah, let's start with this question. You need to know that everything that is medically necessary, TK pays, and every social health insurance pays. It's very hard to say which benefit, which things we pay and which things not. It depends what the dentist says. If you go to see the dentist, he does a cost projection with you, and you come to us with this cost projection, and everything that is medically necessary, that will we pay as TK.
Okay, so like teeth removal, like calculus removal is also covered by TK then, right?
Yes, it's covered. You can do it once a year.
Okay. Is vaccine in Germany free or insured in general?
Yeah, in Germany, the vaccines are free, and it depends on which are recommended. Here's an institute named STIKO, it's Ständige Impfkommission, and they recommend the vaccines, and all that they recommend you can get by only showing your health insurance card, and we pay them.
Okay. The next question would be, does the German health insurance also cover mental health, like consultancy to a therapist?
Yes, it does. You can, like all the doctors, also see a psychologist. You have to go there, search one, and then you can also there show your health insurance card. And also he will does cost projection with you, and but there's no problem. You can also see a psychologist for your mental health. But we also have many things like you can do in preventive. If you have problems with stress or something else, we have something called the e-coach, which you can do from home.
Okay, interesting. Next question. Is physiotherapy also covered?
Yes, physiotherapy is also covered. It's also one of the basics. And here you need a prescription from your family doctor. And with this prescription, you can go and see physiotherapist, but you have to pay a co-payment, a little co-payment, which is 10%.
Okay, co-payment 10%.
Yeah, one additional information maybe at this questions, which is very good benefits. We have an online search for all kinds of doctors or physiotherapeuten or mentalists, where you can find the best doctor for you, or a dentist maybe. It's called TK Ärzteführer. It's a doctor guide for English customers on our website. And maybe for you, when you come to Aachen and you're searching here for a good dentist or a good psychologist, then you can search on our online guide for these doctors, and there are some comments, and so we can recommend then there some doctors for you, also which are speaking English for you. That's also a good advantage we can offer for you to find a good doctor. Yeah,
that's really nice.
And if you want to visit it, I just sent the link into the chat, so you can only click on there and you are already at the doctor guide.
Okay, we will put this on the YouTube later on. Okay, because good. I'm not connected directly to YouTube. Okay, this is also mental health question, vaccines, what's more? Does TK covers medical checkup?
Yeah, TK also covers medical checkups. Like I already said, we are paying very much for preventive care, and the checkups are one point to this. There are some examples like the skin cancer screening, which we pay at an age of 20. And this is a big advantage because other health insurances only pay it at the age of 26. But TK is very interested in your health, and so we pay many checkups and preventive care so that you can visit the doctor. There are some checkups that are recommended at a specific age, and like for example a checkup which is at the age of 35 or something like this, and then we come to you and say this is necessary for you, and we pay it also.
I see. Interesting. Okay, this is also a question about a medical checkup. So there is this question. Hello, I'm Bella. I've applied to TK once, but being rejected because I'm older than 30 years old. May I know the procedure to apply TK insurance for someone around my age? Isn't it supposed to be the same, or is there a bit difference in there?
It's when I the question correctly understand, it's for the process to become a TK member. Is it correct?
Mm-hmm.
Yeah, the process is also the same. Yeah, to register at TK, it's the same, but you are then not in the student insurance. Then you are insured as a, we called it voluntary insurance. And yeah, that's not the student insurance end, but the process to become a member, you can do it online or write an email to us. That's the same like for students which are younger than 30 years old.
Okay. We'll put the notes and any other important links in the video later on. Okay, medical checkups, same percentage. Okay, those are, we have answered that how many percentage of healthcare system apply not receive this kind of healthcare. We have answered that. Let me see the translations. Do people who have a history of certain disease since from Indonesia, for example, oh, it's moving really fast. There's people who have a history of certain diseases since in Indonesia, and then they study to Germany, and then they have this German insurance. Will they be fully covered by the disease? Can you answer that?
Yes, of course. Like I already mentioned, in the social health insurance, we don't check which diseases you had in the past. So if you had many diseases and one of them comes back here in Germany, we pay the cost for it. It doesn't matter how often it comes back, and it doesn't matter which diseases or chronic diseases you have. We don't execute you, and you don't have to pay any extra costs.
Okay. That's nice to hear.
Correct. And here some additional information that's basic or on the principle of solidarity. So when you are ill, the others will help you for the principle of solidarity. And yeah, that's as additional information to this topic.
Okay, what's the difference between private and Staatsversicherung? They mean social health insurance. I think we already have covered that before very extensively. Okay, now this is the questions. Okay. Are prescription drugs covered by the insurance? If so, what medicines are insured?
As I already said, it would be a list that is never ending to list all the medicaments that we pay. But the main thing is basically everything that is medically necessary, the doctor will prescribe you, and you can go to visit the doctor anytime. He will prescribe it to you, and you only have to pay the co-payment, which is 10%, and for medicines it's at maximum 5 to 10 euro.
Okay.
And only you can imagine some things which are supplements, that are in additional normally not paid by TK, because it's not, how Anna said it, medical necessary. When you take a supplement, then you must pay it by yourself.
Okay, that makes sense. So like when you go to the apotheker here, then if it's a supplement, then you need to pay for it.
Correct.
Yes, correct. But here's also a big advantage of TK, that there are some things like alternative medicine, like I already told, like if you have a fever or a cold, there are some things that are based on homeopathic things. And here TK pays up to 100 euros. And this is a big advantage, so that you can also use these alternative medicines.
Yes. I heard alternative medicines are pretty common in Germany. So
yes,
we'll be using that. Okay, this is also about teeth once more. Okay, Frauen Arts. Let me find it first. Frauen Arts is gynecologist. but you know more about the German rather than gynecologist itself. So do you need to have the certificate from the family doctor, or can you go to the gynecologist directly? Is it also covered by TK?
Yes, it's also covered, and you don't have to have any certificate from your family doctor. You can also go on the doctor guide, search a gynecologist in your nearby, and you can make an appointment, go there. You don't have to have any certificate for it. You only have to bring your electronic health insurance card, like always, and yeah, nothing necessarily more.
Okay. Okay, public insurance, I think we already answered that as well, as long as you're students. If a person needs an ambulance, is it also insured? For example, like they're calling the ambulance.
Yeah, it's also insured. When you have an emergency and the ambulance is completely covered by TK, so don't worry, or by public health insurance, don't worry.
Okay, because like in certain countries that's somewhat different, like you need to pay an extra and so on, but it seems nice. Okay, important this. Insurance and psychologist. For the corona vaccines itself, I think we are not accountable to answer that directly. I think we need to ask the government, correct?
Yeah. About corona, the government is your partner, which you must say, but we have here in Germany the prioritization from the people, and as I can see, you as customer must pay for the vaccine of coronavirus. How it pays the government or later the health insurances, that's not I guess that's not regulated right now, but you don't must pay the vaccine. Yeah.
Okay.
And in addition to this, also here I have sent a link which you can put into the description on the video. You can click on it and there's every information round about the coronavirus, everything that you need to know, what is the situation here in Germany, and yeah, maybe then you can read some things about how it's managed here in Germany, because it's a very actual theme topic.
It's pretty topical, and especially because of this drive pretty recently. I hope like anywhere in the world, including Indonesia and Germany, they all are able to get the vaccines quite well. Okay. What else to ask? Psychologists, cover some questions. Okay, are you able to answer this question? Because it's quite spontaneous. Stel de vraag op een oder andere van die versicherungsbureau bekommen würde.
Yeah, this you will get the money back from TK, or the question is in German. Maybe I can answer in German. Is it?
Yeah, sure.
Genau, also das Geld bekommst du dann von der TK zurück. Da brauchst du dir keine Sorgen zu machen, weil das eine medizinische Leistung ist und die TK das dann bezahlt. Ja.
Gut. Noch Fragen? Procedure, 3 years old. Historical check-ups, vaccines, physiotherapy, insurance, vaccines. I think that's all to it, actually. That's almost all to it. Do you want to have a finishing remark to these presentations and questioning and answering session?
Yeah, I found it very good, the questions. So are these types of questions which are yeah, the main custom or a big or yeah, the main customers tell us, yeah, and then yeah, I found it good.
Okay. I think since most of the kinds of the questions have already been answered, there's been popping very, very recently.
And maybe one offer from Anna and me, maybe we can also put the contact details in the chat of YouTube. And if you have some questions which are come in your head, maybe during the next days, you can contact us, send us an email, and we are looking forward to help you and to answer your questions.
That's nice. That's nice. Okay. Like for our Zoom controller, I think we would turn this into an ending. Okay.
Hello, is my voice in already?
Yeah, it's good.
All right, nice. So
All over the streaming?
Yeah, the streaming is over.
Okay, good.
Okay.
wait,
no.
Aren't we gonna do some ending and
yeah, it's still live, but it's now like my screen sharing is over.
Yeah.
Okay.
By the way, the audio is in. I just realized that. Hansen?
Yes.
I'm confused. Are we actually still on the YouTube live or not?
Still. Okay.
Oh, there you go. Yeah, so thank you very much, everybody. I am Ryan, by the way. I'm the current president of PPI Aachen. I just want to say thank you both to Markus and Anna for doing this from TK, and obviously for Video as well. Thank you very much, and his Department of Education as well. We got Hansen, we got Keman, we got Tifano. Thank you very much for organizing this. I think this webinar is obviously very informative and very interesting as well. I hope the audience can take lessons from this. Well, I certainly take a lot of lessons from this, and I think we'll make like some content or some summary, like a YouTube video, and upload it on YouTube so everybody who aren't watching right now can still watch this, right? And yeah, certificates, I think my team had made some certificate as well. So I'll make sure that in the coming week we'll send it to both of you guys. And yeah, I think that's it. Thank you very much, everybody. The audience who has been watching from the beginning. Thank you once again, Markus and Anna, for doing this. And yeah, I think that's it. I'm giving it back to Theo.
Okay, I think we're over here. Then let's end the stream.
Thank you, everybody.
Thank you.